Good afternoon, everyone. Thank you for joining us in this presentation. We're going to spend some time over the next hour talking to you about lessons learned around COVID-19 and the settlement sector, and hopefully provide a great opportunity for some reflection, some learning together, and for us to share some research and practice experiences with you. My name is Oudshoorn. I'm assistant professor in the School of Nursing at Western University, and I do a variety of research around, particularly my focus tends to be on housing challenges. And I've had the opportunity over the last several years to think about housing challenges in the context of settlement and a lot of work particularly with Syrian government-assisted refugees. And so today I'm just your host, and I'm going to help our two presenting groups in sharing with you. And so we're going to start with some research from Western University, and then we're going to look at some practices in a partnership with the Cross-Cultural Learning Center and the Middlesex London Health Unit. We'll have a chance for you to share your questions and comments as we go along, and we'll be working through those with you as well. So I wanted to open with a bit of a reflection myself, and I'm going to invite you to put into the Q&A thoughts that you might have about this particular question. The question is, in your perspective, what's been the impact of COVID-19 on newcomers to Canada? So please, like I said, put your comments in the Q&A about that impact. And so I was thinking about this myself, and there's a study that we've been doing right now with Syrian families who came in 2016 and have been with them now for almost 5 years. Talking about, our focus has been on housing issues for those families. And so we've been meeting with them, talking with them a couple times a year for several years now. And I was reflecting on the conversations that we had with them during the pandemic and what this has meant for those particular families who have been, quite some ways down their journey now of settlement. With the families, they shared with us their hopes and dreams around housing. And for many, that's home ownership is the ultimate goal. Of course, for many, it's just getting into a space that will better accommodate larger families, maybe a part of the community that's closer to the services, their cultural community, work opportunities. And so those families have been working really hard to meet their housing goals. And so for some of them, that has involved things like saving towards a down payment. And families are working hard to find employment that includes things like, older teenage children working in kind of gig economy opportunities to contribute to the whole family to try to improve their housing condition. And what we heard from those families is that because of the financial challenges that have come up in the pandemic, particularly in the loss of hourly wage kind of employment, that they've now had to spend a lot of what they'd been saving towards their housing to get by this year. And, I'll never forget the families who said to us, it's like I've started back at the beginning, after years and years of working to improve their condition. It's like they've fallen back to where they were at the start. So that's just one impact of COVID-19 on newcomers, is seeing those goals, those hopes, those dreams kind of stretch out a little bit further down the line, and feeling like they've gone backwards in this year. But of course, there are many other experiences, and our first presentation is going to get into some of that. So I will introduce to you the first presentation, which I said is a research presentation called Learning from COVID-19 to Enhance Settlement Services for Refugees to Canada. And so this project involves myself, Fazia, who's a PhD student who's going to be doing our presentation today. My colleagues from the School of Nursing, Susanna Kaja and Dr. Sarah Bembo, who's also with Fanshawe College, as well as Vicky Esses from Western University and Iman Arnout, who is our other research assistant on this project. So without further ado, I will turn it over to Fazia to share her presentation with us.
Hi everyone, so again, this is Fazia, and I would like to start my presentation by acknowledging SHIRC for funding this research project, as well as the CCLC for facilitating the recruitment and the data collection process from our participants. So talking about refugees' experience arriving to Canada during the pandemic, for them, the settlement experience can be challenging, and these challenges revolve around transitions, which frequently include building language proficiency, significant cultural adaptation, financial insecurity, social isolation, lengthy legal processes, and dealing with experience of loss. And specifically for government-assisted refugees, long-term settlement outcome include higher rate of poverty and unemployment, and they have a poorer health than the general average Canadian population. Although the settlement worker and services can mitigate some of the risk of poverty and unemployment, the settlement experience in itself is a very challenging and difficult experience they go through. So on top of that, when COVID-19 hit, the next slide, please. When COVID-19 hit, it adds another layer of challenges. These challenges is around reduced the opportunity of informal support, that COVID-19 pandemic has created significant complications to the settlement experience, which is reflected in the cancellation of cultural and religious spaces and events, limits on socialization beyond one's immediate family, and closing of public recreation spaces. It also limits the professional support, although there is a potential that virtual support can improve access for those with transportation limitation. Shifting from in-person to virtual support requires access to the right technology, and it can complicate communication, especially across languages with variability of access to interpretation. So settlement is a significantly isolating experience, and with COVID-19 presumably making this worse. For that, the purpose of our study was to focus on understanding and exploring the experience of these guards families who arrived during the pandemic and the settlement worker through the extreme of their experience and a focus on their unique stories. We have the opportunity to understand what is working for them and what's not, and also with the settlement workers as well. So for that purpose, our research questions, we have covered 4 research questions, and we were focused more on understanding the experience of these government-assisted refugees in settling in a new country during the pandemic, as well as understanding what has worked for them and what hasn't. Also, we wanted to know the strategies that have been adopted for settlement organization to adjust with the context of the pandemic, and what are the strengths and the challenges for providing appropriate support for the newcomers during the pandemic. The methodology for this study was guided by case study, specifically multiple case design by Yin. So this approach explicates a complex human experience, and it allows for maximum depth of exploration into any single participant experience. To that end, we interviewed 6 GARS families, those who arrived as government-assisted refugee in London, Ontario, the week of March 9, 2020, and also the 7 of these settlement services from CCLC, those who were supporting these families during that time. We conducted in-depth interviews with them, as well as kind of group interviews, and these were audio recorded and note-taking as well, and we obtained our ethical approval from Western University. For the analysis part, this analysis followed STIC method, which allows for both direct interpretation of individual cases as well as a degree of case aggregation. So the aim was to answer the research question through analysis within and across cases. This allows for both consideration of common concern as well as understanding support approaches that might prove to be promising practices. And for the finding part, this is more of a methodological tactic. So for the finding part, we combine both finding from staff and families participants. These data were synthesized into a holistic composite to provide greater insight into how unique cases are informing a large regional experience. Then we have 6 of themes coming out from our analysis, and our themes capture elements from refugees, families, and settlement staff experiences during the pandemic of COVID-19, and it expressed the overwhelming sense of participants where they were feeling disconnected from friends and family, from cultural services. They were disconnected from accessing to information and from accessing to health and social services, and with intermittent stay-at-home order and many business closed down, there was an overwhelming sense of isolation. This was in the context of a strong desire to settle, to acquire the language, to get a job, to upgrade their education, and also to improve their housing. So going through our themes, the first theme we named it We Don't Know Yet, Living in a Void. And this theme captured the difficulties that these families encounter regarding the time of government support that has been lost during the first lockdown, and their strive to be independent. And think about this from this perspective. Establishing a new life, building social networks, enrolling in schools, learning a new language, finding a permanent housing, and figuring out the health and the social system of the country during a global pandemic have complicated the settlement experience for this group, especially when they spend almost 6 months of government assistance period between a lockdown and business and school closure and stay-at-home order. All of these factors trigger their feelings of loss and deprivation. These families are The situation of these families are a bit unique, where they are transitioning from the first year of government support without receiving a full year of English education, without establishing a strong social network. All of these, just the idea of establishing a network and human communication and connections can lead to more of formal or informal opportunities for employment. Some of our participants after 6 months of settling here in Canada don't even know their neighborhood yet. They don't know the area around them. So that gives them the feeling that they don't know what is the next step. and what to expect in their journey. Then um, when they arrived into a lockdown, there was a very limited choices in finding some services in a virtual world, and this is what characterized this theme, because accessing to health and social services was particularly difficult without the ability to just walk into a service and see someone to work through any concern. These families were highly dependent on settlement workers, either RAB or CSS, to help them navigate the system. And also, the nature of the communication, the nature of the pandemic, and everything transfer has been transferred online, make them felt ignored by a system in which all they can do is leave a message and wait. For example, there was a significant delay in Canada Child Benefit, and that could be solved by seeing a worker in person at that time after their immediate arrival to Canada. But again, that wasn't possible given the nature of the pandemic. So these families were financially stretched. And they felt the need to take some loans from the very, very few people they have met during their arrival. Again, navigating navigating the system. I'm still in the second theme, and here is another point that is very important in navigating the system in a virtual world is the housing. So housing opportunity would be moved, like seeing houses are virtual, right? So that make them very dependent again on interpretation services if it is available at that time. Um, then the connectivity issue. This theme points out another key element in settlement during the pandemic, and having access to electronic devices and connectivity were the most important key factors. That will take us to our third theme, between four walls, missing connection, which reflects how our participants felt highly socially isolated. Um, where those they knew who had settled before them were highly supported within their cultural community, at local communities, centers, mosques, informal events. This group particularly were severely isolated at the time. But it is important also to notice that during summer, summer provides some break for an opportunity for these families to build some connections outdoor, but it was still there was a sense of loss of opportunities to get to know more people, and that may advance their experience. Then the fourth theme, which is you cannot read an English online environment, going deeper in their experience of settling during the pandemic when navigating a virtual world in English. That poses a lot of challenges for this group, which is what is this theme focused on? The problem was that the lack of translated materials. The participants noted the irony of how easy they can find Arabic translation of COVID-19 information, yet how difficult it was to receive support around, for example, tenant rights, how to complete basic tasks in Canada, how to access a primary health care. For example, signing for a school bus, or looking for the right hospital building when they have in-person appointment. These were some challenges come out because of the language barriers. And if we think about it from this point, the current virtual services our environment provide a very limited translated materials, and this group doesn't speak English. And that again made participants very dependent on the settlement services. Again, that will take us to the next theme. And despite all of these challenges, This theme described the participants' attitude of strength and resilience. We named it We Have Our God, Gratitude, Struggle, Concern, and Resilience. Our participants shared stories about life-threatening situation when fleeing their home countries, and also in transitional transition countries. Um, Although the pandemic of COVID-19 has contributed to their growing anxiety in relation to other aspects of the settlement, they believe that they can adapt to any situation. And think about it, exciting horrors of starvation, violence, financial manipulation, lack of privacy, um, gaps in schooling, breakup with extended family, all of these events um, strengthen their capability to adjust to any situation. And this is something that I sense, we have sensed from the data and the interviews with the families. They have found a solace in migrating to a safe country, but they are equally concerned about establishing a life in Canada regarding the struggles and difficulties around housing, transportation, employment, and the financial instability that they have sensed from the very beginning of their arrival to Canada. Then our last theme really focused on shed lights on the support that settlement staff have provided to these families, and our participants own the staff who were going above and beyond to meet their needs during this tough time. Several families have acknowledged the effort that the settlement workers have put in to meet families' needs during and after the first lockdown, and some families started the interview by telling how settlement workers have taken the initiative to ease their settlement experience. For example, applying for food vouchers, facilitating online medical appointments, or giving them a ride to grocery store, pharmacies, medical appointments, in-person medical appointments. All of these behaviors and stories were noted and appreciated. Uh, on the other hand, when the settlement worker provided all information they could, and after some initial delays in communication process, these information were readily available. However, for a broader health and social services, participants encountered frequent language barriers, and without the option to go and see someone in person, they were often left waiting for response to messages. So, in conclusion, the new circumstances triggered by the pandemic of COVID-19 has increased the workload for settlement worker and intensify these families' experience of settlement. Both were waiting for slow services, just like each other. The families are waiting, the settlement workers were waiting too. So this is how their experiences were shaped during the pandemic. For the recommendation part, what we can learn from this unique situation to improve settlement services and similar experiences in the future. We have summarized some recommendations for several settlement agencies and for settlement services, for example. Having a hybrid model of settlement services will balance the value of being able to support people quickly, as well as quickly, like online by phone or virtually by phone, and also have some moments of human connection. Um, Also, prioritizing internet connectivity upon immediate arrival will help families to have the ability to stay connected while in quarantine or during a stay-at-home order. So it will reduce their sense of social isolation. Also, there is a potential to review the structure and flow of information for newcomers. This might be structured differently to time particular messages and to have a hybrid of what information is available online and what is provided directly through settlement workers. Because from our interviews, it seems that at at that moment, the participants were forgetting key information that were perhaps delivered too early. Um, Another recommendation for IRCC, the Government of Canada, is to expedite the access to child benefit for new arrivals. So these new families wouldn't feel the need to borrow money from the very few people they have met during the 2 weeks of their arrival. Um, Another recommendations for the provincial government of Ontario, is to better align the social assistance income with the cost of living and to have some consistency between the rental market and what these families received as a government support. Also, the translating materials online will help them to better navigate the system, the health and social system better and ensure a high quality of services provided to them. And the last thing is if the health and social services will be provided more on a virtual context, then the need for a better process of communication for these people who are asked to leave message and wait is necessary. Um, in conclusion, refugees who settled during the pandemic have experienced an extreme isolation, um, and they have been in a situation where um, it was tough for them in terms of the social isolation, uncertainty, the language barriers, limited of financial support, and increase that all of these circumstances increase the workload for the settlement services. We believe that changes at the policy level are necessary to address these challenges that stem from the nature of the pandemic itself. That was everything. And here is our reference list. And thank you very much for listening.
Great. Thank you for your presentation, Fazia. I hope that this is valuable to you, that this echoes your experiences and your knowledges as well. I was just looking at the results from the Q&A discussions, and I do invite you to continue to reflect on the impact of the pandemic in the Q&A, as well as welcome you to share any particular questions around the presentations, both the one you've just heard and the one coming up. It jumps out at me absolutely that there is this shared concern around that social isolation. And that what came through in Fazia in your presentation, and I see that in the comments as well. I think we've all experienced a degree of isolation, disconnection, loneliness through the pandemic. But we have to acknowledge that others have more challenging experiences than we do, right? That the pandemic is not equally experienced, and that these families, as Fazia was highlighting, particularly those who arrived right in that week of lockdown and then were settling in a first lockdown, are so incredibly disadvantaged through that experience. So I see, a comment there around mental health as well. Absolutely, right? We know that in that context of that extreme isolation compounded with trauma, that it has a really devastating, or has the potential for a devastating impact on mental health. And while Fazia highlighted, the resilience that we're hearing from these families, at the same time, just that importance of being able to access the right supports, timely access to healthcare was a huge issue for these families, and how, again, everything flipping to online is a challenge if folks don't have the language to navigate our current online environment. There was a request there just to flip back to the recommendations, so I will just flip back there to the Government of Ontario recommendations. The slides will be shared, the presentation will be shared for folks to look at. You know, the one I would like to just reiterate is that third point around the translation of materials, right? If we are switching to a virtual environment for delivery of services, then that is extremely inequitable if only certain people can read and access those services. And so it's really become so much more important that we make our materials, our services online available in languages for all people, if that's the format that we're going to take. So thank you, Fazia, for your presentation and for sharing. So with that, I'm going to invite the team, the combined work from CCLC and Middlesex London Health Unit. I'll invite Vaithi, Joe, and Omar to share with everyone. Thank you.
Hello, everyone. Good afternoon. As Abe mentioned, my name is Vaithi Varajan. I'm an employee at the Cross-Cultural Learner Center. And for the next little bit, my colleague Omar Kudeda and I, as well as Joe Antone from the Middlesex London Health Unit, we're going to be discussing culturally sensitive manners in which we disseminated COVID-19 information to the Yazidi community in London, Ontario. Could you go to the next slide, please, Abe? So just a background on Yazidis for those of you who are not familiar with this population. They are an ethno-religious group who originated in northern Iraq. They speak Kurdish. They have a long history of persecution due to their religious and cultural beliefs. They're a very insular group. They have a monotheistic faith, and for that reason, because of their insular practices that aroused a lot of suspicion from other neighboring groups in that region. So they have a long history of persecution, the most recent of which was in 2014 when ISIS launched a genocide against them. So the majority of Yazidis who were living in that area were either had to flee from ISIS or they were taken on as child soldiers, sex slaves. Many of them were kidnapped and have disappeared. Their whereabouts are unknown. So the community as a whole has faced a great deal of trauma. Next slide, please. So in 2016, the House of Commons in Canada passed a motion to bring some of these individuals who had fled from ISIS and who were settled in internally displaced persons camps in northern Iraq to Canada. So the motion was passed in 2016, and in early 2017, that's when the process came to bring some of these families, many of whom are single parent families, to our country. So London, Calgary, Winnipeg, and Ontario were chosen as the primary locations to bring these families. The reason for this is because these 4 cities already had established Yazidi communities. So the idea was that the Yazidis who'd already been living in these cities for a long time would be able to support the newcomers. Nevertheless, there were several barriers to integration. I know at Cross-Cultural Learner Center, we provide a variety of services, settlement services, community connections, resettlement assistance program, as well as a health settlement program. And there are many different, there's many difficulties working with this population. As I mentioned previously, they are a very insular community, and because of the trauma that they've experienced and the discrimination that they've experienced back home, it a little bit takes a while to build a trusting relationship with them. As well, when you're in a city like London or you're at an organization like the Cross-Cultural Learner Center, there's not that many Yazidi employees. So for someone like myself, for example, I'm an English-speaking Sri Lankan Canadian. I'm not part of their community. That adds an extra barrier to be able to support them in the way that they would benefit from. And some of these barriers, although we were able to work with them over the course of the past 3 years, they kind of flared up again or took on different forms when COVID occurred. Next slide, please. So one of the programs that has worked with this community during the COVID period was the Peer Support Project. which is funded by the London Community Foundation, and which is a collaboration between the Cross-Cultural Learner Centre, Canadian Mental Health Association, the Mary J. Wright Research Centre, and the Marymount Family Support and Crisis Centre. So we primarily work with a lot of the single parents in the community, as well as their children and their teenagers. What we noticed working with these families during the pandemic, it kind of echoes what Fauzia was talking about in her presentation in terms of many of these families do not have adequate literacy skills, either in their native tongue, which is Kurdish, or in English. So that made it difficult for them to access and comprehend accurate resources about COVID. Additionally, using online platforms and being disconnected, physically disconnected from a lot of their peers, that caused a lot of distress. And it made it challenging for our team to be able to kind of bridge the gap between the services that are provided in London regarding COVID and with the community. So at this point, I'm going to pass the presentation on to Joe and Omar, and they're going to go into a little bit more detail about the strategies that the Middlesex London Health Unit and CCLC utilized in order to support the community over the past year. Sorry, next slide, please, Abe. And I think Joe or Omar are going to take over.
Yeah. Omar, did you want to do the next two slides and I'll do the partnership slide?
Yes. Hello, everyone. My name is Omar. I work as a settlement counselor at the London Cross-Cultural Learner Centre, and also a member of the Yazidi community here in London. For the community, it was a challenge before the pandemic, but when the pandemic hit, it was something new to all of us, not just the newcomers. We all suffered. We kind of were lost. We didn't know what to do, but we managed to make ways to communicate. Like, thankfully, the social media, it was huge for me personally to communicate with members of the community, to educate them on what's going on with the pandemic, the steps need to be taken for health and safety, social distancing. And as Vaiti mentioned, there is no, most of them cannot read and write, so I had to do it through communication, either call them or make videos, voice messages, and send it to them so they understand what's going on, so they don't be at risk for health and safety issues. And I still continue work with them. Honestly, it's hard for me to not be involved with them on a daily basis. But the thing is, like, this was new. I had to protect myself as well. I couldn't see them face to face. Everything had to be through social media. They don't have Zoom or emails or all these virtual meetings. We don't have it. It has to be just social media, and particularly WhatsApp, which they all have it and use it well. So that was the main source for me to communicate with them. In some cases, if they had some important documents, I had to take the risk and go make them come to the doors of the CCLC and take it from them, complete it, and send it somehow. I don't need to talk about the culture and the ethnic background, which Vaiti covered most of it. And not just the Yazidi community, I like to mention any newcomer who arrived during this past year. It was a big challenge for all of us. I work with anybody who arrives new, not just the Yazidi community. For me, the biggest challenge is financial, because when they arrive here, their main source of income is the government assistance refugees and the child tax benefit. The government income, which barely covers the rent for them, then we come to the child tax benefit. Now, to add insult to the injury, Service Canada is closed at the airport, and here in town, they don't get social insurance number. We have to apply online. It takes a month or two to receive the social insurance number, and then I have to apply for child tax benefit, which that takes a month or two to receive. And at that time, they struggle with financially because they don't have money to buy anything. The money they receive from the government is barely covers their rent. This is my biggest challenge with the newcomers. I just hope the government will do something about it, like at least just give them social insurance number, have a small office at the airport, or, you know, I hate to say this, if the times are tough, just stop bringing newcomers for the time being, you know, so until we find a solution to this, because we all new to this. This COVID impacted all of us. If you are born here, if you are a Canadian, if you are a newcomer, we just learning from, we all learning from this. For the newcomers, yes, it's tougher because we used to meet them face to face. We used to help them do all their paperwork. Now we cannot do that. It's just if something really, really important, we see them. Other than that, we cannot. It has to be over the phone. Next slide, please. I try my best.
Do you want me to do this slide, Omar?
Yes, please, Joe.
Okay. Afternoon, everyone. My name is Joe Antone. I'm the manager of health equity at the Middlesex London Health Unit, and thanks for being with us today. So I'm going to talk a little bit about what amounted to about a 2-week period of time in June of 2020, where there was a small cluster of confirmed COVID-19 cases amongst London's Yazidi community. So I think it was, I want to say it was June 16th, I received an inquiry from our case and contact management team at the health unit that there was a small cluster of Yazidi folks who were confirmed positive with COVID. And within, I want to say, so the 16th we were informed, and I want to say within about 6 or 7 days, this quite incredible piece of work unfolded. And the end result being some culture-based public health messaging that went out to every single member of the Yazidi community. So I'm going to talk a little bit about, you know, all of that work that happened within a very short period of time, and it was very successful because the outbreak was stopped immediately. So I'll share a little bit about some of the cool work that happened. So it was collaborative in that involved a partnership between the health unit, CCLC, as well as London Intercommunity Health Centre. When I reflect back, one of the things that was really a facilitator in making this happen was there was already pre-existing relationships between our organizations. So we knew each other, we worked together for years leading up to this. So it wasn't like we were having to make one another's acquaintance and get through the trust building and all of that stuff. It was already there, which allowed us to hit the ground running, which I think is a critically important piece of information. And it really amounted to this. The health unit had the public health expertise, and CCLC had the relationships, the proven methods of communication with that community, and we were able to put that all together into a health promotion initiative that was highly successful. You know, due to the collaborative nature of the approach. It was brought together by an increase in reported cases. So I think I shared that there was a cluster of 5, and that cluster of 5 was split between 2 or 3 families that had been interacting with each other. And what we had come to learn through communicating with CCLC and their expertise was that the demographic profile of, you know, a typical Yazidi family in London was typically a mom and several children, and their social habits were as such that the moms would get together to at the park with their kids. Moms would sort of sit on a bench and shoot the breeze with each other, and kids would play with each other. So we had to design a an approach to educate and provide information that was going to A, yield some results, but B, was applicable in the context of Yazidi culture, Yazidi demographics, and social behavior. In addition to the intervention of communicating the information to the community, another part of the intervention actually was providing a staff capacity building intervention to the health unit's case and contact team. So I developed a staff capacity building workshop, and we actually informed, we taught our case and contact management team about the Yazidi population, their demographics, their migration story, some of the common reasons they show up for healthcare treatment in London, as well as ground them in trauma and violence informed principles around effective interviewing with minority ethnic populations. So we did that capacity building piece on the practitioner end, is in addition to the actual health promotion campaign with the Yazidi population. The focus was on effective information diffusion. So really there was two pieces to this. One was the actual content, and the other piece was actually how and who delivered it, which was equally as important. So from a content perspective, you could go on the health unit and find reams of information about COVID-19. All of that is absolutely inaccessible. Most of that is absolutely inaccessible if you have a language or a literacy barrier. So what we did was I worked with our case and contact management team to pull information and create a series of scripts of simplified, understandable information related to COVID. And we developed actually 4 scripts. The first script was what is COVID? So it talked a little bit about the illness, it talked about the symptoms, talked about how it's transmitted. The second script we created was it was titled Ways to Stop Getting the Virus. We talked about things like distancing, not gathering, avoiding voluntary shopping, just doing mandatory shopping, things like that. The third one was what happens if I get the virus? So it really talked about isolation practices and principles, following public health guidance, some of that kind of stuff. And the fourth script we created was actually bubbling up with another family. So this is where, from my perspective, the culture informed lens comes in. So at the time, if you were to read the provincial guidance about gathering and the numbers, at the time, I believe it was gathering no more than 10 people. You could imagine, given what is the typical family, Yazidi family, there was a mom and maybe 5 or 6 kids, that number 10 doesn't really make a whole lot of sense to use. So instead of using that number of 10, what we did was actually create some messaging that said, hook up with another family and create a bubble with another family. So, in the backdrop, knowing that social isolation, which has been spoke to at length already, the first presentation is such an issue, we tried to incorporate, that mitigating that social isolation into the public health messaging. So, I think that was fairly effective because like I said, that the outbreak did stop. So that was the sort of content. Looking at the method of sharing the information and the person communicating it, perhaps even more important than the content. So in meeting with CCLC, what was determined that was the best approach was to have the information, those scripts, translated into a video. And then the other piece was that Omar, who's presenting with us today, is fluent in Kurmanji, the dialect of Kurdish that's being used. So Omar actually filmed those videos, is a member of that community, and was the person that actually delivered that content via the WhatsApp app. You could imagine the difference that it might make if it was, Joe Antone, who has no connections to the Yazidi community, sending this information, how that would be received versus it being sent from Omar, which I think, you know, was a key and intentional part of the intervention, because Omar is a member of the community, has that trust, has the relationships. So it was very intentional that Omar was the sender of those videos. And then the information relay between community service providers and to support those. So I spoke a little bit about Omar sharing that. The other piece that we did was we worked with London Inter-Community Health Centre, who provides primary care to a large majority of London's Yazidi community, as well as other organizations that we know are visited by the Yazidi community. We were able to send some information out to those organizations, and they were able to support in disseminating some of that public health messaging to the Yazidi community, knowing that those are those organizations had established relationships. So it was super. The takeaways for me were that it was collaborative in nature, which made it successful. It was grounded in Yazidi socio-demographic behavior. It was grounded in trauma and violence informed care principles. And the communications were sent by cultural insiders within the community. And I think, you know, all of those pieces put together allowed for a successful intervention.
Appreciate your presentation, and I've put up the slide with the contact information for the CCLC team if anyone would like to follow up with them. So I'm going to bring us back to our question and answer and a chance for us to reflect on some of the questions that have posed. So thank you, Omar, for following up on that one about you know, how do we ensure that we have the best experience for folks that are arriving. I think that's a really vital point, and I think it just resonates between the both presentations, both what Fazio was sharing and what your team shared, right? It's about ensuring that there's that smooth transition and that we set people up for success as much as possible. There's a question that's quite philosophical, and so I don't know, perhaps Vaiti or Joe or both want to address it, but maybe I'll ask it of Joe first, since you've got the term equity in your title. That question is about, you know, this idea of additional resources and supports to newcomer populations, right? So if we're all struggling in the pandemic, if cases are affecting many different communities, you know, why provide extra support to the Yazidi community? And, you know, is there even a risk in doing that you know, Canadian citizens will feel disadvantaged or ignored or missed, or that newcomers are getting more or better kind of public health service than other people? So I'll start that with you, Joe, and others are welcome to weigh in after.
Sure. My first thought when I hear that question, Abe, is that so public health works from a model called proportionate universalism, and that's a fancy way of saying we make sure everyone gets served, but we acknowledge that there are some populations that are underserved and additional resources are required. So I think there's a narrative that exists that when additional resources are put towards a situation, that it's somehow privileging that population, when all it's doing is acknowledging that not every population has equal access to health services or health resources, and that those additional services are just to get that population to a place of having equal or near equal access to the service. So it's not about putting any population in a position to have more access. It's quite the opposite. It's acknowledging that there are populations that have disproportionately good access and others that have disproportionately poor access, and resourcing those populations in such a way that they have equal access to health services.
Great. Well, thank you. I think that's quite a comprehensive answer. Well, I've got you on the microphone. I'm going to put one more question to you. And that is, you mentioned that relationships were part of what made this work, so that there was already that, so those three organizations already working together. Are there any other things that you felt made your intervention so successful?
I honestly think it comes down to the expertise and the built relationships and sort of the settlement model that was already in place through CCLC. The heavy lifting was really done by CCLC in this case. I think all that was required for the most part for the health unit was to make sure that we were providing the content in an understandable way, and CCLC really did the heavy lifting in that they created the videos and disseminated the information. So I think when I look at the collaboration that took place, I think we designed it in a way that all of our organizations were able to put our best foot forward. And we positioned the different roles so that CCLC was doing what they were best at, MLHU was doing what we were best at, and LIHC was doing what we were best at. We weren't putting each other in roles that we didn't have the expertise to do. And we were mindful that there are some roles that we don't have the expertise, which was what made it such a good partnership. Is, it was a bit of a puzzle, and we each had an important piece, and it was an incomplete puzzle if any one of our organizations weren't there.
Thank you.
I just want to chime in as well. Sorry with that question. So our team and Omar worked together making the videos that Joe is talking about. And some of the information that the health unit gave us makes sense to individuals who have been to school. So if you say, for example, stay 6 meters away from the people beside you, if you've been to school and you've taken math classes in elementary school, you kind of know what that is. But for a lot of the individuals that we work with, they have not had the privilege of going to school and they don't know how big that is. So in the videos, we had to physically show them, this is how far apart you have to be. But when it comes to hand washing, there was a hand washing video, I believe, and it had information about hygiene. We had to show them, this is how long you wash your hands for. This is how you put your mask on. So we didn't assume anything. And we also met them at their level and didn't make any assumptions about their prior knowledge, because as I mentioned, they have not had the privilege of having access to certain educational resources, health promotion resources that the average Canadian does have access to. So we were very mindful of that when we were working with the community.
Great, thank you for that addition, Vaithi. And I'm going to actually ask you, stick with you for a second, because you've reflected on this specific situation and the wonderful kind of work and partnership. But I would love to ask you kind of more broadly, through the past year, what have you learned in this settlement work that you would love to share with others who work in the sector? What are thinking about these incredible challenges that families are facing, this unique level of isolation, barriers to resources. So what would you like to share from your settlement team's work to others in terms of what you've learned in this year?
That's a very good question. Obviously, this has been a very tumultuous year for all of us. Our team we've had the privilege of working from home for the past 12 months. So like Omar mentioned, we have to heavily rely on WhatsApp to talk to the adults that we work with. And for a lot of the teenagers, they don't have access to cell phones. They don't have any other way to communicate with us. So we use Facebook Messenger with them. So I think just realizing how to efficiently use technology to communicate with others. I think a connection is a big thing that everybody has kind of been missing during this pandemic. So we've noticed that a lot of the teenagers and children that we work with, sometimes they just want someone to talk to. Like they don't have the ability to physically go to school anymore and hang out with their friends or see their cousins or whatnot. So we just make sure to give them the space to feel comfortable enough to tell us what's going on. Or some things are unifying, like going to school online or using Zoom. I don't think there's anybody who, prefers that to actually being in class and being able to work with your teacher and that sort of thing. I think I've realized our team, my two other colleagues and I, we realized how big of a privilege literacy is, because a lot of the teenagers and children that we work with, when they're in school, they're able to kind of mask the educational gaps that they have. They've found ways to, they're smart kids, but they just haven't had the chance to, when they were with ISIS, they didn't have the chance to go to school. When they were in the camps, they didn't have the chance to go to school. So there's huge educational gaps. When they're actually in school, they can kind of hide their lack of literacy or numeracy knowledge. But when you're online, like you can't do that. And also you have to learn how to use technology. So our team it's challenging at times, especially for someone like me who doesn't speak the same language as them. It is very challenging, but I think just going at your own pace, taking it day by day, and really listening to whatever it is that they are going through. Because there are some unifying factors with COVID, and then there's a lot of other factors that set certain groups apart from other groups. So I think those are some of the lessons that we've learned so far, and I'm glad that we've been able to work as a team to do our best to support them with whatever it is that they need assistance with during this time.
Great. Thank you very much. And so there's a final question, which I'll take, and then I'll bring us to conclusion here. But Jennifer's asked that, the families we looked at were the ones in the research, were the ones who came right during that first wave. And what about how things are for families now, which is a really good question. And, that was a big focus of what we've tried to share with our recommendations from the research, which is that idea of course, we hope that that experience will never happen again. We'll hope for no further pandemics, and so no further families will have to arrive right in the midst of that, and that feeling, that void of information. But really, what can we learn from this experience as things go forward? And so definitely, families feel the same relief as all of us did, especially through that summer when we could be in person again. Joe mentioned the benefit of social connection in public parks, but also just having kids in getting kids into school. In the fall, being able to see support workers in person, so getting that human contact with their settlement workers, all of that, of course, has improved their experience. The challenge, of course, and Fazia alluded to this, is that time window, right? And that sense of, there's a pressure on the pace of people of acquiring the language, of getting credentialing, or having credentials recognized, of employment, right? Because it's that ability to improve when situation comes from those kind of foundational elements of belonging, inclusion, education, employment, language. And so having this delay in the time, having that large kind of void, has definitely left families feeling like they need more support now to get to those outcomes that they would have loved to have in their first year of being here. But I think in terms of looking forward, those ideas of like how can we do hybrid service delivery, right? How can we create and time education to families that balances both online and in-person education, and having the right messages at the right moments of that settlement experience? How can we improve our systems so whereby we're not putting people into deep poverty for so very long? And how do we ensure that people just get access to the income that they are rightfully entitled to in a timely fashion? So all of those messages and lessons, I think, carry on with us, although hopefully we won't have that intensity of the pandemic again. So with that, I would just like to thank everyone, our presenters, for your contributions, for giving your time to this session. I thank everyone for listening in and for sharing your thoughts and your questions with us. and really appreciate that we have this opportunity, this space to reflect on how we can help newcomers really settle well in our communities and be supported and be safe and be healthy. So with that, I will conclude our time together and thank all for participating in this conversation. Have a wonderful day.